Need to reset my Zoom 1 second.
When you get a chance, if you got to go in and out, go. I'll send this out now for all of you. I'll leave it out there. Make sure you sign in. Has to see your name because you know I have to email this to Christine and them. Okay. Let me record this. Record to cloud on this one. This is LaGuardia.
Recording in progress.
Okay. All right. Good evening, everyone. Frank Nuki here, one of the senior instructors for LaGuardia Community College.
Off for a second.
All right. We will be going over chapter 2, chapter 3, and chapter, I think it's 38. If I'm correct, Kenny told me it's WS for workforce safety, and then is medical legal, and then is I think ambulance operations, or they call it in your book, ambulance transportation. So we're going to go over all that. Okay. Specifically break it down for you. You have any questions, you have to stop me. Okay. I want you to, every day, to do better and better, because the midterm, no joke. Okay. Midterm is going to be 100 questions. 100 questions, a point each, and you must score 75 or better. If you're not doing too well in your exams, you got to show them that you still want to be here, okay? Because it may get to a point, I don't know what they're going to do with you, or because if you don't have a passing average GPA, they may tell you, you know, you get that drop from the program, or they may tell you, we're going to give you another chance and put you on academic probation. Don't know. That's your senior instructors. I think it's Irene and Yaduro, if I'm correct, right? So whatever they do, listen to them. It's not the end of the world if something's not going well for you right now also. You can always retake the course. You could do it. Maybe next time is better for you. It could be your study habits, the way you're studying. If you're working and going to school at the same time, that could be interfering a lot. So you may need to take a break. So whatever I could do, you know, Nuki's going to be here for you if you come back. And if you don't, and you still need help, you have my email, you have my cell number, and you have me on WhatsApp. So keep in contact with me. Say, Nuki, I decided not to continue with LaGuardia. I'm going to try another place, maybe different days because it's better for me. I don't know. That's all up to you. But I wanted to know that you have options. Okay. All right. So let's do this. You should see workforce safety. Let's begin here. I am recording this. Make sure. Yes, I am. And everybody signed in already. Beautiful. I want to say hello to Sophie, Jason, and Louis, just in case I didn't, and Palmer, just in case. There you go. Okay, you know how it always starts. It always starts with the National EMS Educational Standard Competencies. And you're going to go into each chapter. We'll talk about infectious disease. You're going to need to know that. They're going to probably give you test questions on that, and also what they call communicable diseases. Okay, know the two separations on there. When I tell you, I'm going to say, okay, make sure you know that, understand that, because this is how they like to give you test questions on the state or class. So you need to know this, okay? Standard safety precautions, always test questions. You know what you always utilize. According to the CDC, you use BSI, body substance, isolation. Okay, remember 3 things you always utilize. Utilize your gloves, your goggles, your face mask. Probably the N95, and then the goggles, and then your gloves. Remember, the N95 is for you. The surgical mask is for your patient, if that was the case. But majority of times, what you're going to do to them, you put on a non-rebreather, right? That's what you normally do. But if they ever talk about a mask that goes on the patient, it's the surgical mask, okay? You are trying to prevent things hitting your mucous membranes. Remember your mucous membranes will be your conjunctiva, right here, the eyes areas, inside the nose, inside the mouth, your anus and your vagina. But here you're worrying about your face. So all the mucous membranes here, eyes, conjunctiva, inside the nose, inside the mouth. We're going to talk about stress. You need to know the different stress they're going to talk about. Acute, delayed, and cumulative stress, okay? You need to know that when we get to that. Dealing with dying patients, okay? I'm going to teach you a mnemonic called DABDA, in that order. And it breaks down each stage in order. Okay, DABDA. First D is deny, and so forth. So you need to know this when we get to it. You're going to say, oh, no wonder he puts it in order. As I say, what is the first stage of grief? Oh, denial. What is the last stage of grief, which is the fifth one? Acceptance. So you need to know the difference when we get to that. All right? We'll talk about that too. These transmissions, they're going to talk about direct direct, indirect, vector, things like that. These words you must know and you must highlight in your book. The one I always see them given is direct contact, that direct transmission, like person to person. Okay? If it's indirect, it's like from the doorknob to your hand, the stretcher to your hands, and so forth. And I'll break it down when we get to that. Just make sure you know that just in case. Okay, they talk about good stress and stress. You need to know directly from your book. You got the stresses you need to know. Okay, and we're going to get into that, and I'm going to tell you what page is on. We're not here yet with them. Everything here they're talking about is your nutrition, balancing your meal and so forth. A lot of that is common sense. Don't mind me. I'm skipping over certain things because it's not as important with the things I really want to touch base on. A lot of it's common sense when you read through this. Okay, here you have to know. Infectious communicable diseases, we're going to go over that right now. From that person to person, communicable, okay? And from one species to another. You're going to see us talking about vector, direct contact, indirect, and so forth. Give me 1 minute. Okay, these words you need to know right here. Pathogen, contamination, exposure, and PPE. Break each one down. If you think of the word pathogen, I want you to think of that microorganism that is capable of causing disease in a suspected host. That's what the word pathogen means. Make sure you highlight that in your textbook. Contamination, that's when it's spread, that infectious organism or foreign body, okay, within objects such as dressings, water, food, needles, wounds, whatever it may be, a patient's body. You need to know that word, contamination. Exposure, situation which a person has contact with blood, body fluids, tissues, airborne particles, okay? Whatever that transmission was, you need to know that word also, okay? So think of the word exposure. And then that PPE, that personal protective equipment, you need to know that. I want you to think of other things that we utilize. Besides your BSI, besides the gloves and the goggles and the face mask, I'm talking more of the helmet, okay? I'm talking about the jacket or the turnout gear you wear, the bunker pants, your boots, okay? Your leather gloves. They get more into the personal protective equipment. If they break it down to fluids and blood, then you're thinking more of your BSI, okay? Standard precautions according to the CDC. That's what you're protecting yourself against. These, the words you must know. In your book, definitely highlight this. Transmission in a way of infection disease spread, that direct contact, bloodborne pathogens. Okay, so if you think of that direct contact, you need something that it can be person to person also. Okay, so blood, they were infected. You touch that blood and so forth. Okay, they touch you, they shake your hand, you have an open cut. Indirect, I want you to think the needles, doorknob, stretcher. The stretcher is the one they always ask. They'll say such and such your old patient was caught and was bleeding profusely, and then the EMT got exposed to this due to the stretcher. Why? Because there was blood on the stretcher. It was clean, but not the way it was supposed to be clean. And it still had blood on it that they really couldn't see. And they touched it with their bare hands, not with gloves. So they wind up with an indirect contact. Think of you contact and indirect contact from LaGuardia. You're in room 329. They're lecturing to you. Someone sneezes into their hand instead of their sleeve. They get up. They go to the bathroom. They open up the doorknob by turning it and go to the bathroom. Of course, they wash their hands over there and everything, but what did they touch before they leave? Right? They touched that doorknob. You go up to grab something from the cafeteria, you turn the doorknob with your hands, you got indirect contact. That's where I want you to remember indirect. Make sure you know that. That airborne, think of them sneezing, okay? Coughing, whatever it may be. It could be droplets come out. That's your airborne transmission. That want to do with foodborne transmission, contaminated food, anything in the food that's contaminated. And then vector, think of fleas, ants, things like that, okay? That would be called vector-borne. So you need to know each one of this, repetition in your head, thinking of them, know what is what, okay? So make sure in your textbook, you're highlighting these words. It's very important, okay? There should be an orange in your book. Now, you're going to see a word called hepatitis B in your textbook. There are different types of hepatitis. There's A, B, C, D, and probably E. The ones I always talk about is A, B, C. That's the ones I always see on exams, okay? If they talk about hepatitis A or hepatitis B, these two have vaccines. Hepatitis A, vaccine. Hepatitis B, vaccine. Hepatitis C, no vaccine. When you're thinking of cirrhosis of the liver, okay, hepatitis to do with jaundice in the eyes or the skin, I want you to think of a liver problem, cirrhosis, okay? Think of hepatitis C, okay? They could help you maintain it and give you injections for it, but there's no cure for it, okay? There's no vaccine for it. It's not like hepatitis A and hepatitis B. I have probably almost every vaccine in my body except for smallpox, okay? I got it for free. If it's free, it's for me. That's Nuki's saying. If it's free, it's for me. So if you're going to give me something free, I have no shame. I'm going to take it from you, okay? Because I know it's going to be worth it for me, especially. So when you get your agency to give you these vaccines and it's free, take them, especially if you're not going to have no reaction to them. Okay, the one I couldn't take was the smallpox vaccine because my kids and my brother have a history of eczema, or what's that other one? Eczema, what's the other one with the skin?
Psoriasis.
Psoriasis, thank you very much. My brain farted for a minute, thank you very much. So they said I couldn't take that vaccine because there's possibility I would have developed smallpox. So I said, okay, I'm not taking it. So know all these, any questions, feel free to ask. Okay, we spoke about the gloves, the gown, the mask you wear. Hand hygiene, number one, always a test question. They ask you, what's the number one thing to prevent all these problems? Hand washing, okay? They tell you to wash it like 20 minutes, right? Years ago, it used to be like a minute and something, okay? After COVID, and they did all this research, they said, okay, 20 seconds, it's good enough, because what's the average person does? They didn't wash their hands, a bunch of pigs. Okay, they go in the bathroom, they urinate or defecate, and they just walk right after. They wipe themselves or whatever they do. It's disgusting, you know. I couldn't do that, you know. And I guarantee that's the same person who don't even know how to wipe their butt correctly. There's a technique to it. And I know you people look at me, Nuki, you weird. Yes. Okay. Yes, Kenny. What's up?
I was just gonna say that's why I have a bidet.
Yeah, a bidet is awesome. Yes, we have one here in the house also. You know, you can get that on Amazon and it's not that expensive. You have to make sure you look at your stool also. Even when you wipe yourself, you need to know what is the consistency before you flush to see if it's little bolitas. You know, there's a problem. You're constipated. If it's watery, comes down like Niagara, we got a problem there too. So it's supposed to be like a U or J shape when it comes out. And you say, are you serious, Nuki? Yeah. So if it's coming off and I don't know, like chunks and pieces, something's wrong. If it comes out in a different color, what did you eat or what kind of medications you're taking? Okay. So I'm trying to make you laugh here at the same time. I know it sounds disgusting, but trust me, you'll learn from this. All right. You can't even tell if you got blood in your stool. They may ask a question about donning or doffing, okay, removing the PPE. They'll teach you that in class and skills if they ever go to that. But this is your test question right here. Hand washing. Number one, hand washing, hand washing, hand washing. Please make sure you know that. Every time I see test questions, I see that with that. Excuse me 1 minute. Just told my son, can I call him later? Because he calls me and they know they have the family calendar. And what is Nuki doing this time? He's on Zoom. They should not be calling me. But it's okay. Still love my kids. To believe my oldest is going to be 41. Damn, I'm getting older. There goes your gloves. You know about gloves. Okay. Eye protection, your goggles. We spoke about that. Gowns, if you need to, you suit up totally. During COVID, they had us doing everything. Donning and doffing, taking off gowns and so forth, and our BSI and everything, and putting it on and so forth. Okay, nice to know. Your mask, very important. This N95 mask, you better know. Please make sure you know that. Okay, that's important. This is your pocket face mask. You know, this is the one-way valve. They ask you about this. This is the one that you could connect to an outlet there and give oxygen through here also. That's called your one-way valve. This here is a sharp container that you would throw away your sharps, like your epi auto injector and things like that, okay? Oh, and hepatitis, if they ask you if you became positive for hepatitis, it doesn't mean you have it. It means you've been exposed to it. That's always a test question. So they'll say one of your PPD, which is the exam, they give you the skin and it swells up what is really red. It's for TB, excuse me, tuberculosis. I said what? I said hepatitis. Sorry about that. For TB, if you became positive on your skin, very red or swollen because they did that PPD exam for the TB, that does not mean you have it. That means you've been exposed to it. In order for them to confirm that you have TB, okay, they have to run more exams, more blood tests and chest x-ray and so forth. Sorry about that. All this is recommended. You should have every one of these shots. If you don't, something's up, okay? If you want to make sure that you don't need a booster, you get what we call blood titers, okay? The titers will tell you if you're immune to any of this or do you need a booster. Each one of these I have, okay? So make sure you get them done also, especially if you're going to work in any kind of EMT or the hospital or a healthcare facility, an office, whatever. Make sure you have all these vaccines and these shots, okay?
What if you can't get them though?
You should be able to get them. What you mean by you can't get them?
I have autoimmune encephalitis, autoimmune disease.
Okay, then you will have to check which ones you can or which one you can't. That I'm not sure what to tell you in the sense of which ones you can or can't.
But
Okay.
they do recommend all of them, right? For the field.
They're going to recommend all of these in the healthcare setting. But if you can't, you're going to tell them your situation, and then you're going to get blood titers to see what you already have in your system. Because they'll be able to go back and say, oh, yeah, Kelly, I don't know if you noticed this, but you had this hepatitis B shot vaccine 10 years ago and you didn't even know it.
Yeah.
Right? When you were a certain age. So it all depends. So definitely get the blood titers from your doctor. Tell them, listen, I need a blood titers for this. I'm going to be going into the healthcare profession. Let me know what I need a boost of, what I don't need, and that would tell you.
Okay.
You know about rinsing your eyes for 20 minutes. That's a 20-20 rule. They ever ask you about 20 minutes for your eyes or 20 minutes for your skin, if some kind of chemical went on your skin, it's always brushing off of the patient's clothing and then irrigation for 20 minutes. If some kind of chemical went in your eyes, it's irrigation for the eyes for 20 minutes. That's why I call it the 20-20 rule. So you'll never forget it, okay? Give me 1 minute. Hold on.
Yo, Kelly, have you had your the physical they ask you to do?
Thank you.
I called
Thank
him
you, my
on
love.
Friday actually. He hasn't got back to me yet. So
Mhm.
hopefully I can get all of the vaccines.
City MD, try to find out. Like, that's where I got my stuff. Like my.
I said I trust my doctors. You know what I'm saying? I have to like 3
Mhm.
specific doctors. I can't just go to any like urgent care.
Wow.
Did they do we have to do anything beyond the health form? I thought it like they keep saying like physical, but I'm pretty sure you just have to have your PCP fill out the health form.
Let me
Yeah.
coffee.
Yes, to my knowledge, Jason, you're 100% correct. LaGuardia normally gives you a health form that you bring to your doctor, and that will say everything of, your blood titers and how you physically fit and everything else to get the okay to work and go on rotation on the ambulance. They would not let you go on rotation with the ambulance without that health form filled out. Make sure you get that done. That's still the same. That hasn't changed that I know of, even in other agencies, okay? So the 20-20 rules, irrigation to the eyes. Just want to make sure you remember that. 20 minutes for the skin. You're seeing safety. This is the ERG book, Emergency Response Guidebook. These are all the different placards you see on the truck. So if you see this on there, it tells you more or less what they're carrying on that truck or that vehicle or that van or whatever it may be, and what you can do to keep a distance and what they want you to do, who you got to call, hazmat, and so forth. Okay. So just know about the ERG book. And you can download this for free on your phone. Okay. You should have the 2020 version. The up-to-date won't be 2020. The next one will probably come out in 2024. They do it like every 4 years, all to do with hazmat materials. This is your turnout gear. They'll maybe talk about your helmet, your gloves, your jacket, your bunker pants, your boots. That would be a form of what we call your PPE, okay? Your protective clothing. They look just like this, okay? Depending what agency you work for, okay? Your gloves, your helmet, boots, things like that. It's up to you. The book also talks about eye protection, ear protection, skin protection to do with sunblock. I always wore my vest. I've been wearing my blue bulletproof vest since 1988. So I still have it here. I don't know if it's still good, but Thank God I never been shot at. Stabbed, yes. Shot at the ambulance, yeah, in Red Hook in Brooklyn. Don't ask me why we're shooting ambulance in Red Hook in Brooklyn, okay? But that's when I was there. That was, my God, it was early 1990, I think it was, 91.
Was it a patient who attempted to stab you?
Oh, the stabbing, yes. Thank God I had the plate in my bulletproof vest that they hit the plate itself, okay? Okay, I got my other kid. Sorry, I can't talk right now. Everybody's calling me, both sons. Next, you know, it's going to be my daughter. Okay, this, okay, this is where we're going to get into deaf and dying patients. And this is what I definitely need you to know. Hold on. Let me bring it up for you. Right here. That is DAB-DUH. These are the stages of grief. You must know this. Okay, I've seen this a lot on the state and probably class. DAB-DUH. Write it, DAB-DUH, abbreviation, D-A-B-D-A in that order. So if they ask you, patients, no, they're not dead. No, they're in denial. If they argue with you and things like that, it's anger, hostility. That's the A. If the person or the family member is trying to say tit for tat kind of thing, that's bargaining. If they have a form of depression, okay, that's different. And if they say no problem, there must be the gates of heaven is open and there's golden streets and all this other stuff, that's acceptance. So know that DAB-DUH. They will ask you what each stage is. So they'll say, what is the first stage? What is the second? What is the third? What is the fourth? What is the fifth? If you know the DAB-DUH, you know it. They may use another name, and I'm trying to find it for you right now. Just give me 1 minute, because it comes up, and I've seen this in exams. Where is the name? Okay. Dr. Elizabeth Kerber-Ross. I don't know what page it is, but it's definitely after death and dying, the grieving process. And then it talks about each stage. They may ask you, according to Dr. Ross or Elizabeth Ross, what are the stages of grief? You need to know all 5 stages, okay? Denial, anger, bargaining, depression, acceptance, okay? Make sure you know that. I always seen that as state and sometimes class questions. Always be honest, allow the patient and family to grieve. Responding to grief. I'm sorry for your loss. It's okay to be angry. It must be hard to accept. That must be painful for you. Things like that, acceptable. Things they don't want you to say. Don't say something like, they're in a better place now. You don't know that, okay? Sorry, but your family expired. Your family member expired. What are they? A gallon of milk? I mean, expired, things like that you don't want to say. So they ask you anything, just know to do with death and dying, okay? This test questions always, they're going to ask you general adaptation syndrome, okay? You need to know that. It's to do with stress, okay? You need to know when dealing with stress, you got good stress and bad stress. It makes you who you are. I want you to remember this, general adaptation syndrome, and use these 3 letters first. A-R-E for this one, because the R is going to represent 3 R's: reaction, resistance, recovery. Okay, so if I give you a test question, it's going to be according to the general adaptation syndrome. It consists of what? Oh, R, alarm, right? Reaction, resistance, recovery, oh, and exhaustion. Even if you don't see the word exhaustion, but it still has alarm, reaction, resistance, or recovery. And if it gets the exhaustion, it's okay. It's still part of this general adaptation syndrome. So I want you to remember A-R-E, R. Got that? You know there's 3 R's: reaction, resistance, and recovery. Make sure you know that that's always a test question. You get a lot of this to do with like your fight and flight. You now normally know this when you're alarmed, you're like this, on the move. You need to know what occurs when you have your fight and flight. Can anyone tell me what happens to your body? Think. What manifests itself?
Adrenaline.
Your adrenaline. Excellent. Yes, which is
The parasympathetic response.
your sympathetic response. Yeah.
Okay.
Sympathetic, the parasympathetic would be the feed and breathe.
Feed and breathe, yeah.
So your fight and flight would be your sympathetic response, your sympathetic nervous system. So when you see that, you'll see things like this: increased heart rate, you may be pale, cool, diaphoretic, you'll have dilated pupils, everything is up, elevated, blood pressure, you name it, okay? You need to know that. So they ask you about that. If it was the parasympathetic, you would see the opposite, okay? You want to see all this. The pupils will be constricted, not dilated, okay? Remember, that would be the parasympathetic nervous system. This you must know right here. They always talk about these stress. You need to know each one. Acute stress reaction, okay? How it occurs during a stressful situation, you need to know that. Acute. Delay manifests after that stressful event. Okay, could be during a crisis, but it's going to be after that stressful event. The one I see a lot is cumulative stress reaction, are the most important to understand. Why? Cumulative stress is like you constantly have that prolonged stress and excessive stress, but it comes together. So God forbid someone here loses their job, and then 3-4 days later, their family member dies, okay? And then they're thrown out of their apartment a week later. Stress after stress after stress, cumulative stress is all building up, and it's going to show, it's going to manifest itself, okay? You need to separate acute stress, delayed stress, and cumulative stress. So acute, delayed, and cumulative. Make sure you know each of those stresses. This is some other stress in what you see, okay? Fatigue, changes in appetite, GI problems, headaches, insomnia, your inability to concentrate. These are signs and symptoms. You can highlight this in your book, okay? And some more physiological symptoms: fear, depression, guilt, things like that. Any questions so far? Okay. CIS, they're going to see the CISD and the CISM, critical incident stress debriefing, CISD, and I think critical incident stress management. You're going to see those 2 words. In those words, I want you to highlight, okay? Because after a certain stressful incident, to do with even the critical incident stress management, you have people who will respond to your stressor to help you, so that the briefing, you may get a person or fellow coworkers who are trained in debriefing to do with stress. So God forbid you see a partner of yours crossing the street to help a patient and a car runs him over. That's acute stress right there. That's going to freak you out, right? They will have someone come to you after that whole incident within 24 to 72 hours to debrief you and to comfort you and to talk to you and so forth. And a lot of these teams, when they do approach you, give you and have you take certain days off to relax and things like that, and try to get your thoughts together and things like that. So know those words in your book. And then you're going to see other words like this. Post-traumatic stress disorder, PTSD. You need to know that word also. Okay, you need to know PTSD, characterized by re-experience that event, over-responding stimuli, night sweats, waking up, the jitters, you name it. This person is having this PTSD. You need to know the word to do with PTSD in your book. They love to give you test questions on that. So make sure you highlight that in your book. Already spoke about this one. Don't forget the debriefing with 24 to 72 hours. So I would give you a test question for that CISM, that debriefing is going to occur within how many hours? What is the minimum? 24. What is the maximum? 72. What are the total hours in between? 24 to 72 hours. So you need to know both of them that way. And then you'll see a word called burnout. Okay? Some people will have a form of burnout. Know that word just in case they ask you. If they ask you on suicide, if a person is suicidal, are they homicidal? The answer is yes. Okay? We want you to know that suicide patients are homicidal. Okay? They want to kill themselves, they want to kill other people also. And the EMS community is very well known for that. And that's the only thing I can remember on workforce safety. Let's answer some questions to see what you read before, what they spoke to you about. See if you can answer some of these questions. 2 to 3 of you put the answer on the chat. I'm going to end the poll. Hopefully everybody signed in. 1, 2, 3, 4, 5, 6, 7, 8. I'm getting a bunch of B's, which is awesome. Okay? A disease that can be spread from person to person is known as B, a communicable disease. A communicable disease can be spread from one person or species to another. Why the other one? Infectious is not it. Transmittable, spreadable. Infection disease. An infection disease is a medical condition caused by the growth and spread of small, harmful organisms within the body. That's for infectious disease. Say that again, Kelly.
Sorry, Noki. So let's say if the question was asking about like a sexual disease, it would be A, right?
Infectious disease, A. For growth, yes.
Okay.
Because you're thinking of some form of STD.
Right.
STD, sexual transmitted disease. A lot of these diseases are bacterial based when you look at them. STDs, you'll learn that when you get further in the book, and they're going to talk about that. I think it's gonorrhea, syphilis, and chlamydia. I think that's the ones they always mention in the textbook. So when you get to that, just read up on that, because they'll ask you a test question on that, and you need to know the difference of each one. Okay? Good, but excellent, not bad. Number 2. The most effective way of preventing the spread of disease is, hand washing, right? Makes sense. According to the CDC, the most effective way of preventing the spread of disease is a thorough hand washing, especially between patients. Up-to-date immunization, PPE, will minimize the risk of contracting a disease, and that makes sense. I thank God that I have all my shots up to date, always wash my hands, always change my uniform, making sure. Number 3. I don't remember catching anything out there. Some of you could read so quickly. I don't know how you do that. Well,
And
careful.
I have to cover half my screen, so I don't look at the answer.
Well, that's okay, but as long as you're feeling comfortable. While caring for a trauma patient, the EMT has blood splashed into her eyes. This is an example of a form of exposure. Makes sense, right? Exposure occurs when a person comes in direct or indirect contact with blood or other bodily fluids. Blood splatter into the eyes is an example of direct contact. It is important to note that exposure does not always lead to infection. Proper use of PPE minimizes this risk. Number 4. Give me 1 minute. I'm going to grab a water.
Standard precautions considered BSI, isn't it?
Yeah, bro, I was just about to answer that shit. What the fuck?
I missed that.
Standard precautions considered BSI, and that falls under the PPE umbrella, right?
Standard precautions, you said, consist of what again?
Is considered BSI, body substance.
Yes,
Okay.
it is a form of BSI, yes. Remember, it's according to what?
CDC.
CDC when it comes to blood and fluid.
Mhm.
So, protective measures that prevent healthcare workers from coming into contact with germs are referred to as, it should be standard precautions. Let's see if it's B. Standard precautions prevent healthcare workers from coming into contact with germs and so forth. Then if you go to the other answers, why it won't be the PPE. PPE is the equipment used to shield healthcare workers from infectious agents. So you see how they separate it? So you think of the 2 different ones. So PPE, keep in mind, let's say infection agents. If it's talking about to do with the germs, then you're thinking of standard precautions according to the CDC. Number 5. You see how they ask this question here? What is the second stage of response in the stress response known as the general adaptation syndrome? And looking at all of this, which one would you pick? Well, there's ARE. I think it was alarm. And then they had, I think it was reaction, resistance, recovery.
Yeah.
Then it had E, exhaustion, right? So
Yeah.
the second one should probably be what? I think a lot of you put D. And D should be the answer. D. The body typically reacts to stress in 3 stages: the alarm response, which is followed by reaction and resistance, and then recovery. If the individual cannot reduce stress, the last stage may progress to exhaustion. Makes sense. Number 6. A condition characterized by a re-experienced event and over-responding to the stimuli that recall the event is called, and a lot of you put post-traumatic stress disorder, PTSD. PTSD may develop after a person has experienced a psychological distressing event. Blank is the fuel to make the body run. Blank. What gives you fuel? Gives you energy.
I read that too fast.
Comida.
Would it be sleep?
For me, it's sleep.
Well, sleep you need, but you need food, right? In
Yeah.
order to give you the energy. That's what you need, right?
Mhm.
C, food. To perform efficiently, you can eat nutritious food. The physical exertion and stress of your job requires high energy output. Number 8. Blame. Yeah, right? Makes sense. It's not bargaining. Which
Mhm.
stage of grieving commonly results in blame? Right here, anger and hostility.
So what's bargaining again?
It's like you're agreeing with it and like a tit for tat. You give me this, I give you that. Yeah, no problem. I got you.
If you save them, I'm gonna give you Lakers tickets.
Yeah, there you go. Something like that.
Okay.
know? It's like a tit for tat kind of thing. You do this for me, I do that for you. I'll take care of you, Kelly. But never mind. Nah, you don't want it. You understand?
Okay.
The person may lash out at the EMT or blame the EMT for the unfortunate event. That was B. Remember, let's all make mistakes here and understand it, and we'll be okay. Here goes bargaining. The patient may try to make a deal. See? That's what the book is telling you. Placards are used on what? Makes sense. You see placards sometimes on what? On
Buildings,
vehicles and
ambulances.
also buildings. Placards are used for buildings and transportation vehicles. Number 10. Trying to wait for some of you, or most of you, to answer it, even if you're wrong. The 5 most common hazards associated with a structural fire include what? And it is A. Smoke, oxygen deficiency, high ambient temperatures, toxic gases, and building collapse. The 5 hazards most commonly associated with a structural fire are smoke, oxygen deficiency, high ambient temperatures, toxic gases, and building collapse. This is always on exams, medical legal, and definitely the state. You need to know medical legal. Okay? What you see a lot on exams, consents. In the first 4 chapters, chapter 1, 2, 3, and 4, is preparatory in the state exam. The state written exam talks about preparatory, which is chapters 1, 2, 3, and 4. You're always going to see test questions from that. Okay, it's like its own section. Confidentiality or privacy, I want you to think of HIPAA law. Okay, when we get to it, I'm going to tell you to highlight that in your book, HIPAA. Make sure you know that when we get to that.
Like you mentioned that before, that word.
Yep,
Sounds
HIPAA. When you see it, when I bring it out to you, you're going to say, oh, I remember this, Nuki. Yeah, you mentioned this before. Okay, I want to make sure you know that because when you see it, it's always test questions. Okay. you're going to get words like advanced directives. Okay. They're going to talk about a DNR, a living will, a healthcare proxy. Healthcare proxy and living wills, we do not accept in the pre-hospital care setting. I'll say it again. Healthcare proxy or living wills, we do not accept in the pre-hospital care setting. Do we accept everything else? Yes, especially the DNR, do not resuscitate, things like that. So you're going to see test questions on that too. You better make sure you know the difference. We'll talk about to do with criminal actions, like they'll come out with words like assault and battery. Okay, you need to know those words when we get to it. Consent, express consent, informed consent, involuntary consent. Okay, you need to know this. Applied consent. You need to know words like emancipated minor. Okay, all these we're going to break down because you always see these on tests. Consent, permission to render care. You need to know that the competent patient, the competent person. Let's say I'm a 39-year-old male who's competent. I could give you a form of express consent. I could go like this. Kelly says to me, excuse me, hello, my name is EMT Kelly. I'm here to help you. What is your name? I'm Nuki. Mr. Nuki, you could call me. Well, Mr. Nuki, what seems to be the problem today? And I explained to her, I'm not feeling well. I have chest pains. And she says, well, I'm going to ask you a few more questions, but at the same time, do I have your permission to take your blood pressure and so forth? They nod their head. That's nonverbal, but that's still consent. Or if I say yes, you may. Okay, that's consent. I gave you a verbal one there. That is a form of express consent, also known as actual consent. Make sure you know that. You will get test questions on that in the state especially. Okay, so make sure you know those words. This word you need to know, decision-making capacity. That person is able to make a decision-making capacity. Okay, it is in your book. Make sure you understand that. So that person is able, have sound mind, able to say, yes, you could treat me with no problem. I understand everything you're telling me, what you're providing, and so forth. So you're going to give them that form of express consent. If for some reason, okay, if for some reason I was unconscious, unresponsive, or had a form of altered mental status, whatever the altered mental status may be, you are going to treat that person under implied consent. Implied consent. So express, you know that, AKA actual consent right there. You know it, make sure you understand that. If you get to a point with the risk and consequences of the patient, that is going to be called informed consent. When we get to that, I'm going to tell you to highlight that. But now you have express consent, and then you need to know this one. Implied consent. You must know that one. So think of any patient, unconscious, unresponsive. Any patient with a form of altered mental status. Okay? So if I have lack of oxygen or my sugar's low, I have a form of altered mental status, right? AMS. I fall under implied consent. If I'm unconscious or unresponsive on the floor, yes, Kenny.
Don't you actually have to call telemetry to get with someone who's under altered mental status to get the implied consent from the doctor?
Okay, depending what's wrong with them. What are you talking about?
Let's say schizophrenics having an episode.
According to protocol, that automatically you could treat them. You don't need consent from the doctor. You don't need to call medical control. Okay. If you know that this patient has a history, the HPI, history of present illness, and they have all the medications and so forth, and it's in the apartment or the room or the house, you could just treat them accordingly. You don't need, you go under protocol. So it's allowed to treat that patient. It's
Thank
when
you.
patient don't want to be treated, that's when you got to call telemetry. And there's certain age or there's certain things going on, like they had low sugar. You treated them under implied consent. You gave them glucose. They came back. They said, what the hell happened?
I thought we weren't allowed to give. That's out of the scope of practice for EMS.
Say that again.
I thought that was out of the scope of practice of EMS.
What's out of the scope of
Giving
practice?
glucose to oh no, not glucose. I think it's actually just insulin, right?
Insulin. We don't give insulin,
Okay.
right? Not even medics give insulin, okay? It's you're allowed to give sugar. So make sure you know you're allowed to give sugar. Under New York State protocol for the hypoglycemic patient, you give a form of glucose, the tube, a drink, any type of fruit juice, regular soda, non-diet. Test questions right there. Also, the patient, according to New York State, must be able to drink and swallow on their own. You do not give sugar, glucose to a patient who's unconscious or unresponsive. You don't give them that tube. You don't try to. That's contraindicated. You don't. So when we get to that in the future with diabetes, I'm going to talk about that. I'll give you a nice review on that, and you're going to love it because I break down diabetes because I'm a type 2 diabetic. My son is type 1, so I know about diabetes to help you there. Okay, so there goes your implied consent. Involuntary consent is another consent. Applies to patients who are mentally ill in a behavioral psychological crisis, according to the book. Okay. Minor consent. These are test questions right here. So I gave you actual express consent already. I gave you implied consent. I told you in order for you to get consent, you also must give them a form of informed consent. That's when you tell them the risks and consequences of potential benefits and treatment and so forth. So a patient tells me, I don't want to go to hospital, and I'm going to let them know the risks and consequences. I just gave them also informed consent. Okay, so you might need to know each of these words. Now, when it comes to minors and so forth, this word you must know. In your book, only talks about these right here. Married, armed services, and parents, okay? That's in your book too. It goes further than that. You need to know that it goes down to what we call self-supporting, wants to be treated for a form of STD, sexual transmitted disease, okay? Things like that. If they emancipated and they also the female have delivered a baby as a child, emancipated minor. So you need to know these words. It's on page, it's on your legal medical handout that I gave you on your WhatsApp. Look under legal medical. It should be 10 pages. It's awesome. That's broken down a lot to do with New York State. Okay, make sure you know that. And then you'll see a word called local parentis. Where is it? I just saw it somewhere. Teachers and school officials may act in the place of the parents. That word to do with them taking over is called local parentis. In loco parentis, LOCO parentis, PARENTIS. Okay, that provides consent for treatment and injuries to do with the school or even a camping site or anything like that, that they could have the okay to get your child treated. It's called local parentis, especially in New York City, New York State, in the schools. You need to know that. Can we restrain a patient? Yes. Using forcible restraints for their safety and ours? The answer is yes. Make sure you know that. If they give you any test questions on that, know that.
Wait, restrain. I thought our safety was first.
Our safety is first, yes. But if for our safety, if I need to restrain, let's say Lewis, I'm going to say, Kenny, help me, because Lewis is a big guy.
I'll grab his legs.
I'm going to say, you know what? I need besides Kenny, and let's say I also need Hamish and Sophie, us four are gonna take care of Lewis, and we're gonna
Gonna do
restrain
this.
him. Who knows? We may get
But
Jonathan and Jason
even-
involved in there, and Kelly. So all of us gonna restrain him because he's so big and tall.
do we need a PD though there if we're
You
gonna
can-
restrain somebody?
See, you can call PD. Yes, Lewis, what's up? I see your hand up. He puts his hand up. He don't mind being restrained. He's,
No, I'm good. It's just it felt a little excessive. That's it.
what about all of us jumping on you to restrain you?
Yeah, I mean, like 7 people. I'm not that big.
We taking you down, homie.
That's right. And we're going to restrain you for your safety and our safety. And Kelly was right. It's our safety first. But if he's some person who's hypoxic or has a form of low blood sugar and he's very combative, I need to take care of him, but also take care of us. Okay. Yes, they do usually have patients, police to come there to take care of it. You can call for police to help you restrain the patient out in the field. Okay? Yes, you can. If they're back in your ambulance, Kenny, then it's you. Can you pull over this ambulance and say, partner, get to the back here. You stop the vehicle because the patient's beating you up. Yes, I'm gonna hopefully have PD there too, and then all of us are gonna restrain you.
It's like
Yes.
your partner get the bat.
There you go. So make sure you know about forcible restraints. Highlight that in your book. And then, can you RMA? Can you refuse medical aid? Can a patient refuse medical treatment? The answer is yes. They have to be a patient who's competent, who knows what's going on. And if they tell you, you know what, I don't want to go to the hospital, I changed my mind, they have a right to refuse. That's an
Ruki,
RMA. Yes,
what was the short term for it? Or what?
RMA.
Or like M as in monster?
Like Mike and Mary.
Okay. Or
RMA. My apologies on my pronunciation.
no,
Refuse
it's okay.
medical aid.
It's okay.
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 Remember, they have to be that patient, and look at the word they use: conscious, alert adults with a decision-making capacity have a right to refuse treatment. You have to remember that. Okay? They can withdraw treatment at any time and say, you know what? No, never mind. I don't want to go with you guys. I appreciate it. Where do I sign? I'm going to RMA. Okay. And you have them sign your PCR, your ACR. There you go. Look who's here. Confidentiality. What word do you think is going to come up right now that I mentioned before? What was those?
HIPAA.
HIPAA, right here. Health Insurance Probability and Accountability Act of 1996, HIPAA, contains a section on patient privacy, strength privacy laws, safeguards patient confidentiality, considers information to be protected, health information, PHI. Know this HIPAA. You always see it on exams. Make sure you know the HIPAA law. Yeah. This you must know, DNR, always exams. So in your book, on the advanced directives, look under the do not resuscitate, okay? Order, make sure you know that. If you get an advanced directive, a written document that specifies medical treatment for the competent patient, or even the healthcare directive or healthcare proxy, okay? Know the difference of each one under advanced directives. Remember this, we do not accept healthcare proxies or living wills in the pre-hospital care setting. The most you're going to see is the DNR. They love to ask test questions on do not resuscitate. Okay. Here goes this. We don't accept this. Living will and healthcare. Here, DNR's orders must meet the following requirements. Okay. State the patient's medical problems, patient's legal parent or guardian, signature of the physician, and not expired. Needs to have all that. Okay. It could be a card that may look like this. Okay? It may be a piece of paper, okay, that says do not resuscitate. Or it may be a bracelet or necklace that states it right on it. Yes, Louis.
You answered it. Thank you.
Okay.
I actually do have a question because a lot of us got this wrong, the DNR bracelet thingy. Can anyone just buy a bracelet that literally just says DNR in it and we have to assume it's valid?
A majority of times, if I remember correctly, I seen some bracelets out in the pharmacies and places like that talks about what they were allergic to and so forth, and it was imprinted there. I'm going to assume, which I hate to assume, that majority of patients who are going to wear that is because they do have some kind of medical condition. If it's a DNR and they have it, I'm going to assume that they have all the other legal documentation for that bracelet. What if you don't and you do something wrong because you didn't recognize it and you didn't check it and now you get sued? Oh, I didn't know it was legit because they could have buy that over the pharmacy, over the counter. I don't know. A good lawyer will have you for dinner, breakfast. A good lawyer will know what to do. So,
Okay, I got that wrong in the
look at
last
that.
test.
According to Jason also, he's saying most DNRs braces tell you the location of the official document. Order is in the wallet. Yes, a lot of the times it is in the wallet. Yes, it is. So there goes, and that answers another one, Kenny. Oh, look at it. He brought it up also. He brought it up. There you go. See? So it's good to know, right? Make sure you highlight that in your textbook.
Same, Kelly. Same.
Any coffee?
Well, we're going to take a break right now if you want to. We have signs of death. They always love to ask you test questions. This you need to know. That patient's head is completely severed, decapitation. I had 4 of those in my years with EMS. Really cool. You're like head over there and body over here. Real cool. I'm like, wow, that is awesome. I had me adjust the head in the back of my ambulance for the police officer. And that was in the early 90s. And he was taking a Polaroid of it. He said, Nuki. I said, what? He said, can you adjust the head for me? And he was sitting on the captain chairs in the back of the ambulance. The body's facing that way, and the head is facing towards the captain's chair. And I got my 2 fingers going like this, holding the head in place. It was so cool. That's not me. That's me. I'm crazy. So
Did you
that.
ever throw up?
No.
Get nauseous? You never got nauseous?
I love it.
What was the most gruesome thing you've ever seen on the field?
Well, the brains.
Never ask an EMT, bro.
No, it doesn't bother me. I seen head splattered, a patient committed suicide, jumped from 27 stories, landed
Nice.
head first, and it
You
hit
said it.
the awning and it hit also the sidewalk, and the brain matter was all over. And it went so far that the guy was a young 15-year-old was sitting on a car, like sitting back leaning that the splatter went on his face. And I saw all that. And after that, for some reason, I was hungry. I said, I want some big ziti.
Homie's like, yo, I want some chili right now.
Oh my God.
I was, yes, once a Marine, always a Marine. Yeah. So it doesn't bother me. I love it. I really do. What can I tell you? People's sickness and the injury, you're going to laugh, but you're going to say, Nuki, you're crazy. It's my satisfaction. I like it.
Yeah.
If I don't have a job if they're not dead or dying or sick or injured. I can't.
I just wouldn't want to see a suicide or someone get shot in front of me. I don't want to see that.
Oh, to me, nothing better than a good stabbing or shooting early in the morning or late at night. It's awesome. That's just me. Know these words, you're going to see it on your exams. Decapitation, blood settings, dependent lividity, rigor mortis, the stiffening, organ mortis, cooling of the body until it matches the ambient environment. And this word, always see it on exams. Putrefaction or decomposition. You always see this on tests. Okay, make sure you know this.
I actually never seen that word. Can you go back?
Yes.
The last one.
Putrefaction and decomposition. It should be on in your book, right after figure 3-5, when you see the dependent liability, you should see that on the next page. Let me see, it was before that? Yeah, on the next page, right above the words of wisdoms and the EMT oath. Make sure you highlight those orange words. That's very important to know.
All right.
What do you mean? Which did you do first? What are you talking about?
Marine or EMT? I'm pretty sure that was a question.
Oh, Marine. I was a Marine before I became an EMT. 1980, I was in the Marine Corps. Damn, that's what, 43 years ago. Damn.
Damn, Nuki, you old, bro.
I'm kind of older. I'm not old. Don't let the boy head, no hair fool you, okay? DOA, you need to know, dead on arrival. Yeah, gangster. I was in gangs too, before I was even in the Marine Corps. So you took a person from the street, grew up in the street besides college and everything, and then you taught me how to kill legally. So I know it's kind of crazy, right? From gangster to títere to a good Christian to a Marine, and then, of course, a great husband, good husband, and so forth, father, and then EMT and paramedic, like that, I guess, and an educator. I try to be a good teacher, good educator to all of you. DOA, you need to know, dead on arrival. DOS, dead on scene. You may see these words, okay? I don't worry too much about the organ donuts. You can read up on that.
I should have never did that.
Don't worry about it. Don't
You
feel
can avoid
bad.
it.
You could avoid it if you want to, but you got to understand this, Kelly. If you did do it, or any one of you, is it wrong? I don't think so. If you're still young and healthy, and God forbid something happens to you, that you are able to donate your organs to someone who really needs it, your eyes, your liver, your kidneys, whatever it may be, your lungs. I mean, that's a blessing. Your heart. Me, they wouldn't want what I have. I got a bunch of problems. You understand? Cancer, diabetes, high blood pressure, sleep apnea, you name it. I mean, what the hell I don't have? But I'm at that age. Remember what we talked about, you're going to know. After a certain age, like 65 and up, after age 30, for those who are older than 30 here, okay, you lose 1% of your body functions each year, depending on your health. So if you're 35, guess what? Depending on your health, you lost already 5% of your body functions. If you're 65, you lost 35%. And everything tends to slow down after that age. You're going to see that when you get to the elderly, geriatrics. Here goes medical identification insignia, DNR, orders, allergies, diabetes, and so forth. There goes one of the bracelets. You need to know this word, scope of practice and standard of care. If you see the scope of practice, that's your level of training. You need to know your protocols and standing orders. That's one of the same, standing orders and protocols. That's everything you do, unless you call the doctor, then you're going online medical control or PPMC, prior permission from medical control, depending how you see it. So know that. So if it's indirect, think of protocol standing orders, indirect, okay? If it's direct, you're talking directly to the doctor. Medical control, you're speaking with the medical director. You need to know these words, okay? So your scope of practice, thinking about your level of training and so forth. If you see words like negligence and criminal offense, highlight that in your book. The standard of care is how you act or behave. That's always a test question. Standard of care, how you act or behave. You keep up to date on everything to do your textbook, your skills, and your CPR cards. Your certifications, that's what you will have. This you need to know coming up right now. Always test questions. They're going to ask, how do you prove, or how do a lawyer will prove negligence if you mess up? Okay. What's negligence? Negligence you think of when you do something wrong. You fail to provide the same care that a reasonable person trained in the same thing you're doing is not similar. So you do something wrong. You fall about 4 or 5 things that you need to know to prove negligence. And one of them is the duty to act. These right here, you need to know this. Always test question. They're going to ask you, in order for the lawyer to prove negligence, what do they have to have? They have to have and know that you have a duty to act. Did you breach your duty? Damages and injury and causation. Okay, you need to know that in case that comes up. So know all these 5. Okay. Sorry, Margie.
Okay.
So that's negligence. You'll see words in your textbook like res, espa, le corte. Yeah, know these words coming up. So are you comfortable with duty to act, breach of duty, damages, causation? You highlighted in the book. Do you know what each one means? There you go. Thank you, Kenny. I don't know how you do that quick. I couldn't. You copy and paste and you already have it up there for the students, which is awesome. And then these right here. Just highlight that in the book and note it. They give you a test question to do with this. I'll be right there to eat. Okay? Is the food about ready, Marge?
It is ready. You don't have to go, just pick it up.
Okay, I'll be right there. Okay? I got me some leftover fish, so you know I'm gonna go eat.
What
Okay,
type
one
of
more
fish?
done here. Yeah, fish. I like fish.
No,
Fish-
what type of fish?
What happened again, Kenny?
What type of fish?
I think it's bass.
Mm.
It was a little piece left over from my Colombian food from yesterday.
Ah,
I
bon
couldn't eat
appetit.
it. That thing was this big. You know, and it still had the eye looking at me. So I had to cover the eye.
Yeah, I feel like in every Colombian restaurant they serve the plates like this big.
Isn't it? Am I right or wrong?
Yeah.
Right?
Yeah, yeah,
like
definitely.
more
Colombian,
people.
right? Maria,
Yeah.
you Colombian, so she knows exactly what I'm talking about.
Oh yeah, yeah.
I love it.
Very big plates.
Right? It's a big fish, right, my love? And then if you get rice and beans and totones right there, forget about it. And then before they give you those appetizers, what do you call it? Empanadas? They're small.
Yeah,
but
they
they're
give the
thick.
yeah,
Oh, they're
yeah,
delicious.
yeah. They're good. Oh, my camera is glitching.
You're glitching.
Know these, just hang, you know the word abandonment. If they ask you the word abandonment, okay, know those words. It's not too difficult. This is always exams also. They ask you the word assault and battery. Know these. So the ones I want you to know, battery, unlawful touching a person, assault, unlawful placing a person in fear of immediate bodily harm, like restraint. So think of assault and battery. Highlight that in your book. Abandonment. Okay. If you do something with one patient and you're taking care of them, let's say you're on a call and then right down the block, maybe a half a block or a block later, you see it, there's a gunshot wound victim and they're waving to you. And you tell that patient you were just treating, oh no, I'll be right back. I got to go take care of that gunshot. You left that patient there. That's abandonment. Okay. Remember, know the words abandonment. Once you make physical contact with the patient, you cannot abandon. Here goes a good example. If you get a patient that you go to a home or an apartment and your carbon monoxide detector goes off, that's one you carry. The door was slightly open and you see your patient in the room. They look like they're sleeping. They could be unconscious, but your machine goes off. Do you enter that apartment and go in and treat that patient, or you back away and call for hazmat, fire department, things like that? Did you abandon that patient? No, you didn't. You never made physical contact with that patient. You following me? If you saw that patient in there and you was in there and you just started treating them, and then your machine goes off, that detector, you must take that patient with you. Okay? If you left that patient there or you leave that patient there, that's abandonment. So make sure you know the difference, please. And we went over that. You can highlight the word kidnapping, false imprisonment. Good Samaritan law, you can highlight that also. Yeah, we did pretty decent here. Okay, the next is going to be review some questions. We'll do this after the break. I'm sorry that I didn't give you a break before. We'll do the questions and then we'll go over the ambulance operation ones. And then we'll go over more stuff, make sure we touch base, and then we'll call it a night. But any questions on workforce safety or medical legal that you're not sure of, that you have to go back or we need to go back from anything, from the consents to anything, informed consent, express consent, implied consent, emancipated minor. You need to know all this because they're going to ask you RMA.
There was something you had mentioned about someone. I think you said you'll talk more about it. Of someone who's unconscious and is like a diabetic or something like that. You said
Hypoglycemic.
Yeah, that thing.
Okay, the hypoglycemic patient.
Mhm.
If a patient is unconscious or unresponsive, but you know they're hypoglycemic, that means they have low blood sugar. You cannot give them any sugar to them in any form. That means you carry a tube on your ambulance that normally you would squeeze it in the cheek area, the buccal area of their mouth, but they have to be able to drink and swallow on their own. Since they're unconscious, unresponsive, it is contraindicated to give something to that patient to do with a form of sugar because they're unconscious or unresponsive. Okay, that's contraindicated. If they're conscious and they're able to drink and swallow on their own, I could see you then give them a form of glucose. You need to know the forms of glucose that you could give according to New York State protocol. You could give the gel, you could give any liquid, water with sugar, any type of fruit juice. You could give soda, non-diet. Okay. I do not remember us carrying those sugar tablets on the ambulance. I don't remember seeing them. Okay. So I don't remember seeing that even in protocol. That could be a registry question. God bless you. But that's what I meant about the hypoglycemic patient. Are you comfortable with that, Kelly?
Yeah, I just never heard of a hypoglycemic patient.
Okay, you're gonna get that when you go further on these future chapters. I think it's under hematologic emergencies and endocrine. I think that's that chapter, endocrine and hematologic emergencies. That's to do with diabetes, the hormones, insulin and glucose, and people like hemophilia, thrombophilia, DVTs, things like that. You're going to learn that in future chapters. Should be coming up soon. You're not too far away from it.
Okay.
All right. How long you, ladies and gentlemen, would like to take your break for?
30 minutes. No, I'm playing.
The usual 15 that turns to 20.
You know how that goes. See, I don't.
Yeah.
Might as well just make it 30, right?
No, it's gonna be 15 because it's gonna be about 20. I know you already. So I'll see you soon. Let's go all eat something. All right. I'm gonna pause the recording. Answer them. See how good you guys are. And ladies. Excuse me. Oh boy. My allergies are kicking my butt. Okay, you arrive at the scene of an older woman complaining of chest pains. In assessing her, she holds her arm out for you to take her blood pressure. This is an example of what? She's holding out her arm to you.
Put B at first.
Okay. A would be what? Unconscious, unresponsive, right? A form of altered mental status. B, okay, is to do with risk and consequences and not going and so forth. D, no such thing. C is express consent. Express consent, also called actual consent, is when the patient authorized you to provide treatment and transport either verbally or non-verbally. For example, a patient who holds out his or her arm to allow you to take a blood pressure is nonverbal, giving you express consent. Okay. All the other ones implied, that's unconscious and so forth, unresponsive, some form of altered mental status. So remember, express consent. Is she competent and so forth? She nods her head or she sticks out her arm for you to take the blood pressure. That's a form of express consent. Okay, looks like a few of you put in D, I think. 1A. Okay, which of the following is example of abandonment?
Oh,
You could change your answer if you want to.
no, go ahead. I know why.
Okay.
I got that wrong.
An EMT transfer care of an EM patient to an EMR. That level of training, there has to be equal level of training, lesser. That's abandonment. They abandon their patient. Abandonment occurs when a patient care is terminated without the patient's consent or when care is transferred to a provider of lesser training and level of certification. Makes sense. Number 3. Unauthorized confinement of a person is called what? So far, I think I see a few C's. Kelly, I know you meant to put C because I see a V there instead.
Mhm.
Because it's right, the keys are right next to each other, and it is C. Forced imprisonment is defined as the confinement of a person without legal authority of or the person's consent. Number 4. I see a bunch of you, looks like you're putting,
This one's a little confusing for me.
failure of the EMT to provide the same care as another EMT with the same training is called what? Okay, won't be libel, won't be slander. It's between C and D. Abandonment, you know what it is.
Relieving.
Negligence would be the best answer. Negligence, right? You think of negligence, if they could prove negligence and so forth too. So, an EMT could be held liable for negligence if he or she fails to provide the same care as another EMT with the same training would provide in the same situation. For example, if an EMT fails to give oxygen to a patient with shortness of breath, an intervention that is clearly indicated, he or she may be held liable for negligence. Okay? Duty to act, breach of duty, and so forth. Breach of duty, you have to keep in your head words like commission and omission. Okay? Malfeasance, misfeasance. Misfeces like mistake. Malfeces like something bad, wrong. Mala. Okay, malo. Understand? That's how you have to look at that word when you see breach of duty. Okay. Number 5. You see a lot of you putting A. An 8-year-old boy was struck by a car, is unconscious, and is bleeding from the mouth. A police officer tells you that he is unable to contact the child's parents. You should, and it makes sense. Continue treatment of the child and transport as soon as possible would be A. That patient technically falls under what when you really look at it, right? The child is in scenarios critical injury and requires immediate treatment and transport. Waiting till the parents are contact wastes time and increases the chance of negative outcome. If you're unable to contact a minor's parents or legal guardian, you should proceed in the care based on the law of implied consent. That patient falls under unconsciousness or unresponsiveness or a form of altered mental status. Number 6. Take a guess. What's an advance directive? Of you, two of you pick C, one pick B, okay? An advance directive is, and is C, a written document that specifies the care you should provide if the patient is unable to make a decision. An advance directive is written document signed by the patient and a witness that specifies the medical care that should be provided if the patient loses decision-making capacity. Example, he or she is no longer deemed competent. Number 7. Which of the following patients is competent and can legally refuse EMS care? Right? The best answer here, competent is the key. Yes, it is. Okay? A conscious and alert woman who is severe pain from a broken leg. A patient who is legal age, 18 in most states, is conscious and is alert to person, place, time, and event, likely has decision-making capacity and can legally refuse EMS care. However, patients who are confused, possibly intoxicated or delusional are not capable of making rational decisions. Therefore, you should provide care based on the law of implied consent. You
I'm
are
always
You are treating a patient with apparently emotional crisis. After the patient refuses treatment, you tell him that you will call the police and have him restrained. If he does not give you consent, your action is this case an example of what? Is it assault? Is it battery? Is it negligence? Is it abandonment? Well, I won't think it's abandonment. So D's out of the question. I don't think it's negligence. So it's between assault and battery, A or B, right? And A is what?
So,
Fear of immediate bodily harm, right?
Oh shit.
Yeah, so it is.
Right?
Okay, so it is.
I picked
It's
A.
assault and battery is physically, right? Assault and battery. It's the wording. Sometimes it's confusing, assault and battery, or battery and assault. So let's see. Is it A? Yes, it is. Unlawfully placing a person in fear of immediate bodily harm, example, having him restrained without the consent constitute assault. Okay? So that's why that one. There you go. Battery, unlawfully touching a patient, a person, that including giving care without consent. Number 9. The EMT has a legal duty to act if he or she is what? Do I have a legal duty to act if I'm off duty?
No.
No, I don't. Pay for his or her services, but it's not on duty? There you go. A lot of you going with B. Out of his or her jurisdiction and seeing a man choking? No.
That's something I would do. I'm sorry.
I know that. It's okay. The correct answer
My instinct. I'm sorry.
is B. A volunteer is on duty and dispatch on a call. You have a legal duty to act. The EMT, paid or volunteer, has a legal duty to act if he or she is on a duty and dispatch on a call, regardless of the nature of the call. If the EMT is off duty and or out of his or her jurisdiction, he or she has a moral obligation to act, but not a legal one. Number 10. Force. Force. Which of the following statements about records and reports is false? A lot of you so far I'm seeing is put in D. Your patient care report does not become a part of the patient hospital record because your treatment was provided outside the hospital. That makes no sense. It is part of the patient's record, your PCR, your ACR, and so forth, everything you document. The statement in your patient care report does not become part of the patient's hospital record because your treatment was provided outside the hospital is incorrect. Your patient care report does, in fact, become a permanent part of the patient hospital record. It is a legal document. It is the continuity of care. It is used for research and training and so forth, and data, you know? So okay, transport decisions. Transport operations or ambulance operations, they used to call them all the time. Let's see here. Give me 1 minute. Okay, ambulance operations. We're going to talk a little bit about that, and most likely what you'll see when they ask you questions, stay in class. Air medical, okay, that's to do with like medevacs, to do with the helicopter. Some states are to do with planes, like Hawaii and things like that. Besides helicopter, they call it air medical. Questions I always see on that is to do when approaching the helicopter or the landing zone. The LZ should be like 100 by 100, things like that. I always see to do with test questions. When they get into more of the ambulance operations, you'll see a word called due regard or due caution. You don't fly through a red light or a stop sign. You have to stop completely and proceed with due regard or due caution. Remember those words, DUE regard or DUE caution. Due caution or due regard. For example, you're approaching a red light, your lights and sirens. You come to that red light, you come to a complete stop, and then you look to the left, look to the right, look to the left, look to the right, and then proceed slowly with lights and sirens through that red light. That is due regard. Same thing with a stop sign. You don't fly through there. Another example they give, and they always like to ask you test questions, is a school bus. Do you fly through a school bus when it has the stop sign out and the flashing red lights? No. But Nuki, someone's dying in the back of my ambulance. Well, if it's their time, it's their time. Okay? If they die, they die. Your partner, whoever's teching that day is in the back, they know CPR, let them do CPR. You do not proceed to the flashing red lights, that stop sign that comes out of the school bus and the arms that go to the side. You wait. Flashing red light stop, sign goes in, arms go in. Sometimes you proceed with due caution very slowly, or the school bus driver, he or she will wave you on to go now. That's where you have to be careful. So know that also. We love to give you questions to do with railroad crossings also. Know that. Those gates are down, those arms are down in the railroad crossing, you stop. You don't go around them. You don't proceed to that at all. Again, you wait. Things like to do with an accident. If you're in an accident, if you're going to an accident and the car is on the road, the number I always see is 100 feet or more. So that 100 feet is where you're going to go past that accident. The book states in front of it or behind it. I do not like to be behind that accident. I like to be in front of it. Okay? Let the big fire trucks and other apparatuses cover behind that accident. They're larger. Okay? I always went 100, 150 feet past it. Okay? So make sure you know that. Know that 100, because that 100, you're going to see it 100 by 100 landing zone for the helicopters, so for the medevacs, or 100 feet in front of that vehicle that you may see in the accident when you go with your ambulance. So know that. In your ambulance, you do medical supplies. In your book, you're going to see a bunch of pages to do with what's supposed to be carried on your ambulance. According to your vehicle design, is designed by that NFPA 1917 standard automotive ambulance, and it tells you exactly how the ambulance should be designed, more or less, and what should it carry on it. New York State calls all the equipment that you carry on that ambulance called Part 800, PART 800, Part 800. You need to know that for the state, okay? Make sure you know that. So it's going to tell you everything you carry or supposed to have on that ambulance. Okay, make sure you know that. And I'm talking all the different types of ambulance you're going to see out there. So you're going to see a type 1, a type 2, and a type 3. Okay, all the ambulances have this: driver's compartment, patient compartment, equipment and supplies, two-way radio communications, designed for maximum safety, efficiency, and comfort. But these you must know: type 1, type 2, and type 3. If I drive a type 1, that's the one here that the module ambulance body that can be transferred to a newer chassis as needed. It's like that big box. So you could pick up that big box is damaged and then take that big box and put it on a different chassis, okay, that's working properly, okay? If the chassis was defective, then you could take off that box or that modular and put it somewhere else. So in your book, it shows you type 1, type 2, type 3, A, B, and C. Type 1 is A, okay? Type 2 is B, which is the van. And type 3 is the walkthrough. What I mean by that, you can actually stop your vehicle, pull over to the side, and just come from the driver compartment, turn around, and go into the compartment right there where the patient is, the patient compartment. That's called a drive-through. So I need you to know these 3: type 1, type 2, type 3. If they ask you any test questions on this, you know the difference, okay? So you got the conventional one module that you can transfer, chassis, module to chassis, excuse me, type 2 the van, and type 3 the walkthrough. Know that in case they ask you any test questions. That's how they look. Type 1, type 2, type 3. Any questions on the different types so far? No? Good.
One question.
Yes.
Number 3 is the hardest to drive, right? Because it doesn't have that you guys have the camera mirror now though, right? In ambulances.
Are you talking about
When you reverse, like I'm talking about like when just general
a
parking.
lot of them when you reverse, they have that you can see what's behind you, but each one of these, you work mostly with your side view mirrors, okay? These side view mirrors here, just like your regular car, these side view mirrors here. When you have your rear view mirror in the van, you can see the back of the windows, but sometimes you can't see what's actually behind you unless a little higher, like a truck, SUV. But a car, if it's too close to you, you may not see it, okay? So mostly some agencies will have that you have the backup mirrors, the rear view, that when you put your car or your vehicle in reverse, it shows you everything that's in the back, okay? But mostly you'll be using your side view. Or if not, you have a page or your partner to get out and back you into the bay to help you and so forth. So it all depends, okay? But all these, they're really easy to drive. If you ever drove a van,
Yeah, I have.
like this, yeah, van. If you ever drove a van, you should be able to drive these. Yes, these are a little larger, okay? This is the one you see a lot outside in the field in the city. This one too. These, when you see the walkthroughs, a lot of the hospitals like Columbia Presbyterian and other these hospitals, they have money, so they can buy these walkthroughs easy, Could they have these two also? But yes, but they like convenience, a lot of their EMTs and paramedics. So it all depends on the agency, but each one of these, you will go through certain courses. One is called EVOC, Emergency Vehicle Operation Course. And then there's another one called CEVO, CEVO, Coaching Emergency Vehicles Operations. That's like your 5-hour class that you do for your regular driver's license, but to do with emergency vehicles, called CEVO. They're probably up to CEVO number 4 now, okay? Depending on your agency and depending on what you could get out there, you can even take these courses. They're separate. These are all the phases of the core. So you go through these 1 through 9, okay? And I'm only going to touch base on what is very important. Your preparation phase, 1 to 11, you'll see all the equipment that's going to be carried on the ambulance. This is everything you carry on the ambulance. Okay? These are all the gauzes and the 2x4, 4x4s, 5x9s, 10x12, bandages, cling, which is the wrap, things like that. All this, band-aids, you name it, you have it, okay? This is part of the Part 800. You also carry on your ambulance portable suctions that you can bring with you, a CPR board, okay? You have all this, basic supplies, airway and ventilation equipment. We're talking airway adjuncts, BVMs, non-rebreathers, nasal cannulas, Venturi masks, you name it, it's going to be on there. Basic wound supplies, everything for when a person gets cut, amputation, avulsions, abrasions, lacerations, it's going to be on the ambulance. If they have fracture management, you're going to get these supplies, splinting supplies, childbirth supplies, automatic external defibrillator, the AD, just like you learned in CPR. You all did your CPR already, correct?
Yeah.
Yeah, so you remember all this, the AD and so forth. And then what else you carry? This, your stretcher. Besides a longboard, a scoop. You need to know this equipment and these devices. Then this one, your portable junk kit, AKA your 5-minute kit, AKA your tech bag, okay? These are things you need to know. Everything here, test question would be your junk kit. You bring this with you. It's everything you need in the first 5 minutes, okay? So know these things and these equipment. And then you have other devices that you carry, your personal protective equipment, your equipment for work areas, safety offer, vests, everything's going to be on your ambulance on the side compartments. They're just letting you know this is all preparation phase. Safety and operation equipment, navigation, extrication equipment, you name it, will probably be on your ambulance also. Personnel they talk about, 1 EMT, 1 paramedic, or 2 EMTs or 2 paramedics. That's how they do it out in the field. Okay, you're going to have me and Kelly, me and Lewis, Maria and myself, Maria and Kelly, working as partners out in the field. 2 EMTs, 2 paramedics, or depending on your agency and what they're doing, you may have 1 EMT driving and the paramedic with that EMT, and that paramedic is the one that's doing mostly the teching. Are you both EMTs and an EMT paramedic? Yes. Your EMT and your certification, and the other one is a paramedic, an EMT P. Okay, remember, you have to be an EMT first before you become a paramedic. You do your daily inspection on your ambulance, review safety precautions, everything to do. You check the oxygen tanks, you name it. You need to know this. Your dispatch, they give you the job, nature of call, name, present location, callback number, you name it, how many patients, and any other pertinent information. En route, you get the dispatch call. Okay, this is where you're preparing mentally and everything and knowing what you need to do for your patient. Okay, you're making sure you have all your gloves, your equipment, your stethoscope, your BP cuff, you name it. Okay, you're en route to the call. You arrive at the call, you take care of the patient, you look for any of these hazards. That's what you're normally going to do with these calls. You just got to read all this, know the phases of the ambulance call, and what is required with each section. Okay? If it was more than 1 patient, it's considered a mass casualty incident. If it's just 1 patient, okay, you could take care. I could take care easily, comfortably, 3 patients in my ambulance with no problem. 1 in the stretcher, 1 on the captain's chair, 1 in the bench with me, if it was needed. Okay? But the average you normally do is 1 to 2 patients, depending on the situation. MCI, mass casualty incident or multiple casualty incident, according to what I've been reading, especially in New York City, it's 5 or more patients or 2 or more ambulance required. That's considered an MCI mass casualty incident or multiple casualty incident. That's what they consider an MCI. So remember that just in case they ask you. Safety parking, you need to know this number. This is always on test. 100 feet before or past that crash. I go 100 feet past it. The reason why, I'm very careful. I remember in 1994 when one of the EMTs got killed on the job when they were parked, double parked on the incident, and then a person was going so fast, he hit a parked car so hard that it crushed, killed one of the EMTs, okay, Prescott, and the other one broke her legs. Okay, she survived, he died, right on scene. Okay, so I like to go 100 feet past it. Know this word also, uphill, upwind. So if you see something to do with hazard material or anything, your ambulance should be not only parked at 100 feet past it, but it should be uphill, upwind. There's always a test question to do with smoke or fumes or hazard materials. Uphill or upwind. That is your test question answer when you see it. Okay? Don't forget this 100 feet. Don't forget this. Very important. Always leave with your lights and sirens on and so forth. That's how you should be parked. That would be me. That would be the accident. There goes the fire truck. Okay? That's just me. Safety parking, continue, set your brakes and so forth. Traffic control, safety first, let the police officers take care of all that. Can you use reflectors? The answer is yes. Do you have reflectors on your vehicle? Yes. Could you put out any cones and things like that? Yes. Wear your vest? Yes. Your uniform normally has reflectors on it. Okay, so that will let other people, especially at night, see you. There goes your transfer phase. That's your equipment, your stretcher, your stair chair, things like that. You know how to monitor your patient every 5 or 15 minutes, stable, unstable, always test questions. Let the hospital know you're coming. Okay, you could restock when you're at the ER bay once you get there and so forth. That's EMT, after transferring the patient to the hospital, he's restocking. If he comes out of the hospital, he probably has a room with all his equipment there and he's doing it. Can you clean and disinfect things and restock? The answer is yes. And post-run. This word you must know. Cleaning, disinfecting, always test questions. If they ask you the word cleaning, you need to know that's the process of removing dirt, dust, or blood, or other visible contaminants from the surface or equipment. That is the word cleaning. If they ask you disinfection, that's the killing of pathogenic agents by directly applying a chemical made for that purpose to that surface or equipment. If it's the other one, high-level disinfection, that's the killing of that pathogen agent by the use of a potent means of disinfection. And then sterilization, a process such as the use of heat that removes all the microbial contaminants. So you ever see people, dentists or certain operation on the rooms, they have the stainless steel and that equipment was sterilized. That's what they mean by sterilization. So know these words. I always see them on tests. Know the word decontaminate.
What sterilization is used in EMS?
Sterilization and using EMS when medics or certain equipment that you have is going to be sent to a place that has to do sterilization for that. So let's say if they had the metal, medics have the metal laryngoscopes and the Miller and McIntosh blades. They don't clean that in their station. They send that out to be cleaned. You follow me? If it's something that's portable or that you could throw away, like a BVM or laryngoscope blade that's plastic, that's one-time use, that's different and gets dumped. But when you use things like stainless steel, sterilization is very important. Awesome. Strip linen and stretcher, place them in plastic bag, designated receptacles if you have that in your station, you know, or the hospital, if you work at a hospital, you know, anything that's spoiled linen that needs to be dumped and so forth, you put it there. And normally you do like a 1-for-1 exchange, depending on the hospital you work at or you go to, okay? This may be a test question right here. Clean the stretcher with a germicidal, vericidal solution at a 1:100 bleach dilution, in case they ask you that. 1:100 is the test question I would see on there. This vehicle has to be stabilized. If they use a vehicle to give you a test question that you see a vehicle on this side, before you go in there, this vehicle must be stabilized. They will use a form of cribbing to stabilize this. If you ever play Jenga, and you remember those blocks in Jenga, 3 this way, 3 that way, 3 this way, 3 that way, but imagine that on the side where the roof is not totally on its back on the top of the roof, but on the side like this, they're putting cribbing where it won't turn side to side using hydraulics or these wood blocks and so forth. It's called cribbing, cribbing. Make sure you know that word. I've seen that on the state. All your driving characteristics you need to know, just highlight that. Safe driving, always wear your seatbelt. Driving anticipation, always be and know what we call defensive driver. I always taught my students, or I have always driven, like I'm a big target on my ambulance. It's a big bullseye, and everybody's trying to hit me. I do that in my car also. So I'm a very good driver, okay? So you'll be a good defensive driver, and you know you're expecting, you're looking out for everything. So you're anticipating everything also. When you're looking forward, you're looking to the sides, you're looking to your rear view, you're looking to your side view. You could see 100 feet, maybe 150 feet in front of you, and you're anticipating of someone trying to walk out through there or even closer. So know that in case they ask you. This always on test. Know your cushion of safety, okay? Know that you maintain a following distance from the vehicle in front or behind you, okay? So if you look into your rear view and you can see the headlights behind your rear view, that means that vehicle, seeing a headlight, is a good distance away from your vehicle, okay? It should be like a car length. If the person's in front of you, and if you can see the bottom of their rear tires, that's a good distance also. You always want to be, especially on the highway, a bunch of car lengths in distance away. So the car length, let's say each car length, I don't know, I'm just throwing out this number, 12 feet, right? 12 feet, 12 feet, 12 feet, 12 feet. So you figure if you're driving on the highway, you should be at least 4 to 5 car lengths away from the other driver. You should not tailgate. Okay, things like that, they want to make sure you know, even with this ambulance. So know what to do. You got to look out for your blind spot. Okay, if you're a good driver like myself, you don't need to do this. Tell me if I'm wrong. Do some of you do this? You're driving and then you're doing this, right?
I don't do that. I'm so used to driving. I go for it.
Right, and you go for it, but you got to be careful because you can hit some vehicle in your blind spot. So if you're good using your side views, without even using your rear view yet, your side views, because in the ambulance, that's what you're going to be utilizing a lot. All you have to do is lean a little forward and then look to that direction for your blind spot. You don't even have to turn your face, okay? Yeah, that's funny. That's true. Maybe. Jesus, take the wheel. You guys are so bad. But yes, but know your blind spots. Know how to use your side view mirrors, your rear view mirror, and so forth. It's very important. Okay. Excessive speeds, they allow you to go up to like 10 miles per hour over the speed limit. Let me tell you this right now. I know this is being recorded. I used to go way past that 10. I would go so fast. I was not speeding. I was flying low. That's how fast I was going. Okay. Yeah, I know it's wrong, but I knew my ambulance. I knew how to drive. Okay. According to what you read and what they tell you to do, 10 miles per hour above the speed limit. Siren syndrome, be careful with that. Causes drivers to drive fast in the presence of a siren due to an increased anxiety. So they'll drive faster. They try to go behind you. They do a lot of things that is very dangerous. Okay. And they also forget that when they're driving, they have a tendency of you keeping one tone. So when you're driving your ambulance and you do one tone, and let's say you're going woo, 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 woo with your ambulance, and then there's another ambulance behind you. If they have that same tone, one of you are going to get into an accident, and most likely it's going to be the one behind you. Because when you're going through an intersection with due regard, they're going to see the first one and they're going to hear it, but they're not going to hear the second one really because it's the same siren sound. So if you're doing an escort and you're the first one, do a certain sound different from the one behind you, so they can anticipate the other drivers that there's two different ambulances. You got that? It's very important. Road positioning, you can read up on that. Here, the test questions I always see is hydroplane, right here, this one. Be alert for hydroplaning, water or roadway, decrease in visibility, and ice and slippery surface like black ice. Hydroplaning at speeds of greater than 30 miles per hour, a tire may lift off the road as water piles up under it, not letting it have that friction it's supposed to have. So it's like floating. Okay, that's hydroplaning. Make sure you know that, please. Wet brakes, you got to be careful also. Most accidents happen at dusk or dawn, okay? Early in the morning or getting to the late at night when the sun is setting and so forth, okay? So be careful with that. Know the laws and regulations. They're going to ask you there, how can you park and stand in a legal location? Okay, you're allowed to. How you proceed to a red traffic light or stop sign with due regard. Okay, but you have to stop first. Remember the speed limit. Can you go up a one-way street? Yes, I did it many times. I even went up a highway the opposite way. In Brooklyn, I went up on 4th Avenue the opposite way. I went on the other lane, and they're coming this way because there was so much traffic there. Okay, it's you know your ambulance, you know what you're doing, you're driving, still with due regard. Will they see an ambulance coming towards them on the opposite side? On their side, they're going to move, trust me, okay, as long as you have your lights and sirens going. Never assume you always have the right of way. It's always a test question. Escorts here, that's what I told you about. Get an escort, be careful with the escorts. Remember, change the siren sound. These are your distractions you can have. Just highlight that in your book. Driving alone, being tired, fatigue, okay? Here, test questions to do with this. You're going to see to do with the helicopters, call them medevacs, okay? Especially the helicopters. Why call for a medevac? Transport time to the hospital is going to take longer than necessary. You have to go to a specific hospital. I have yet to see EMTs allowed to go on the medic backs. Medics I've seen, flight nurses and things like that, yes. Doctors, yes, but not EMTs, okay? Just know word medic back, highlight that. And then when you get into this, let me show you what you really need to know here. Right here. Always test questions right here. Establish a landing zone, the LZ. They say the recommended one is the 100 by 100. Can you do 60 by 60 feet? Yes, but 100 by 100. So remember, 100 by 100 landing zone. 100 feet or more to do with parking your ambulance in front. You know why I prefer in front, not behind, right? So know this. When you're going to be approaching the helicopter in that landing zone, landing zone safety and patient traffic. Keep a safe distance from the aircraft. Okay, is on the ground and hot. Stay away from the tail router. Always approach the helicopter from the front. These are test questions. Make sure you know that. Okay, so you want to approach them from the front, crotched over. Okay, remember that the blades are so long that they could drop at least 4 feet down. Okay, so be careful there. Know that. They may ask you a test question on that. And that's how it looks. That's how you approach. See the 4 feet? This I never seen on test questions. Nice to know. This so is test question 2. Landing on even ground. Helicopter must land on uneven ground. Extreme caution. The main rotor blade will be closer to the ground on the uphill. You see how the danger. Approach from the side here. Little to here, they can see you. Okay? It's very important. They had no choice but to land like that. That's it.